Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about dyspepsia, often called indigestion, and why probiotics may help some people when the upper stomach feels heavy, bloated, burning, or uncomfortable after eating. Look at the pattern first. Dyspepsia is not just a sensitive stomach. It can feel like upper abdominal pain, early fullness, post-meal fullness, nausea, belching, bloating, or burning in the upper abdomen. Some people say, "Doctor, I eat a small amount and I feel stuffed." Others say, "I feel pressure under my ribs after meals." Ask yourself, when does it happen? After fatty meals? After coffee? When stressed? At night? With weight loss? With vomiting? With black stool? The pattern matters because dyspepsia is a symptom group, not one single disease. Now, before we talk about probiotics, do this carefully. Separate simple indigestion from warning signs. If your discomfort feels like chest pressure, spreads to the arm, jaw, neck, or back, comes with sweating, shortness of breath, fainting, or severe weakness, treat it as possible heart disease and seek emergency care. As an emergency doctor, I need you to hear that clearly. Not every indigestion feeling comes from the stomach. The heart can speak in the language of upper abdominal discomfort, especially in older adults, women, and people with diabetes. Also seek medical evaluation if you have trouble swallowing, painful swallowing, repeated vomiting, vomiting blood, black stools, unexplained weight loss, anemia, a new symptom after age 60, a strong family history of upper digestive cancer, severe persistent pain, or symptoms that keep returning despite basic care. Do not cover these signs with supplements. Get examined. So where do probiotics fit? Probiotics are live microorganisms that, when given in adequate amounts, may provide a health benefit. That definition is important because it means the benefit depends on the organism, the dose, the condition, and the person. A probiotic is not one universal product. Lactobacillus is not the same as bifidobacterium. A capsule is not the same as yogurt. A strain studied in one trial is not automatically equal to a different strain on a store shelf. Why could probiotics help dyspepsia? Start with the gut environment. For years, many people imagined the stomach as almost sterile because of acid, but the upper digestive tract has its own microbial community. In some people with functional dyspepsia, studies suggest there may be changes in the stomach and small intestine microbiome, low-grade inflammation, altered gut barrier function, and changes in how nerves sense stretching, acid, and food. That does not mean bacteria are the whole story. It means bacteria may be one part of a bigger system. Functional dyspepsia is often described as a disorder of gut-brain interaction. Why? Because the stomach, small intestine, immune system, hormones, and nervous system are constantly communicating. If the stomach does not relax properly after food enters, you may feel full too soon. If the stomach empties slowly in some people, fullness and nausea may increase. If nerves become more sensitive, a normal amount of gas or stretching may feel painful. If the duodenal lining, the first part of the small intestine, becomes more irritated, acid and fat may trigger symptoms more strongly. Now ask, how could probiotics influence that system? First, probiotics may help regulate the microbial balance in the upper gut. Some strains can compete with less helpful bacteria, produce substances that influence the gut environment, and support a more stable microbial pattern. Do not think of this as killing bad bacteria in a simple way. Think of it more like improving the neighborhood conditions so the digestive tract behaves more calmly. Second, probiotics may influence inflammation. Some dyspepsia research points toward low-grade inflammation in the duodenum, including immune cell activation in certain patients. If the lining becomes more reactive, normal digestion can feel uncomfortable. Some probiotic strains may help reduce inflammatory signaling and support the gut barrier. Why does the barrier matter? Because the gut lining is not just a pipe, it is a living border. It decides what should pass, what should be blocked, and how strongly the immune system should respond. A calmer border may mean fewer symptoms for some people. Third, probiotics may affect bloating and gas handling. Many people with dyspepsia also overlap with irritable bowel symptoms, constipation, or food sensitivities. If fermentation patterns are off, gas can increase, or the nervous system may interpret normal gas as distress. Certain probiotics may help some people with bloating, although responses vary. Pay attention to this. If probiotics make bloating worse, stop and reassess. More bacteria is not always better for every person. Fourth, probiotics may support treatment when Helicobacter pylori is involved. H. pylori is a bacterium that can infect the stomach and is linked with ulcers, gastritis, and some dyspepsia symptoms. Guidelines often recommend testing and treating H. pylori in appropriate patients with dyspepsia, especially in younger people without alarm features depending on local practice. Probiotics are not a replacement for antibiotic treatment when H. pylori needs treatment, but some studies suggest selected probiotics may reduce antibiotic-associated diarrhea, improve tolerability, and sometimes help eradication regimens work better. The key word is selected. Use this as an add-on only with your clinician's plan, not as a substitute. Fifth, probiotics may influence gut motility and signaling. The digestive tract moves food through a coordinated pattern of muscle contractions and nerve signals. Some probiotic strains may affect serotonin signaling, bile acid metabolism, short-chain fatty acid production, and communication between microbes and gut nerves. This area is still developing, but it gives us a reasonable biological explanation for why some patients feel less fullness, less bloating, or less discomfort after a structured trial. Now let's be honest about the evidence. Clinical studies on probiotics for functional dyspepsia show possible benefit, but the data are not as strong or consistent as we would like. Some trials and reviews suggest improvement in global symptoms, fullness, bloating, or quality of life. But studies often use different strains, different doses, different treatment lengths, and different patient groups. That makes it difficult to say, this exact product will work for everyone. So do not use probiotics with magical thinking. Use them as a measured trial. Look at your symptoms before starting. Write them down. Rate your upper abdominal pain from 0 to 10. Rate fullness after meals. Rate bloating. Note nausea. Note stool changes. Do this for 1 week before starting. Why? Because if you do not measure the baseline, you will not know whether the probiotic helped, did nothing, or made things worse. Then choose a probiotic with clear labeling. Look for the genus, species, and strain, not just vague claims. Look for a dose listed as colony-forming units and check the expiration date. Choose products from companies that do third-party testing when possible. Avoid buying based only on dramatic marketing language. A plain, well-labeled product is often a better choice than an expensive bottle with big promises. How long should you try it? In many practical cases, a 4 to 8 week trial is reasonable unless your clinician recommends a different plan. Start with 1 product, not 5. Do not mix capsules, fermented drinks, powders, and multiple supplements at once. If you change everything, you learn nothing. Start with 1 intervention and track the response. Take it consistently. Some probiotics are taken with food, some without food, depending on the product. Follow the label. If you are sensitive, begin with a lower dose for several days. Pay attention to gas, bloating, cramps, diarrhea, or constipation. Mild gas can happen at the beginning, but severe symptoms should not be ignored. If symptoms worsen and stay worse, stop. Now combine probiotics with the basics, because dyspepsia is often triggered by stomach mechanics and nerve sensitivity. Eat smaller meals, slow down, chew well, Avoid lying down right after eating. Limit late night meals. Look at coffee, alcohol, carbonated drinks, high-fat meals, spicy foods, chocolate, peppermint, and large portions. Do not remove everything forever. Instead, identify your triggers with a 2-week symptom diary. Ask yourself, which food repeats before symptoms? Which habits repeat? Which situations repeat? Stress matters too, but not in the dismissive way people sometimes say it. It is not all in your head. The gut has nerves, immune cells, hormones, and muscle layers that respond to stress chemistry. Poor sleep and chronic tension can increase pain sensitivity and change motility. So breathe before meals, sit while eating. Do not eat while rushing, driving, arguing, or scrolling through stressful content. Give your stomach a quieter signal. Medication review is essential. Non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen can irritate the stomach and contribute to ulcers or gastritis. Aspirin can do the same. Iron tablets, potassium pills, some antibiotics, diabetes, medications like GLP-1 receptor agonists, and some osteoporosis medicines can cause upper digestive symptoms. Do not stop prescribed medication on your own, but ask your clinician or pharmacist, could any of my medicines be contributing? If you are pregnant, immunocompromised, have a central venous catheter, severe chronic illness, advanced liver disease, severe pancreatitis, recent major surgery, or are giving probiotics to an infant or medically fragile person, get medical advice first. Most healthy adults tolerate probiotics well, but live microorganisms deserve respect in people with vulnerable immune systems. Also be careful if you have suspected small intestinal bacterial overgrowth. Some people with dyspepsia, bloating, and bowel changes may have too much fermentation in the small intestine. In those cases, some probiotics help, some do nothing, and some worsen gas and pressure. Pay attention to your own response. Your body is data. Where do acid reducers fit? Many patients with dyspepsia improve with acid suppression, especially if burning or reflux-like symptoms are present. Others may need H. Pylori testing, endoscopy, prokinetic medicines, neuromodulators, or treatment for overlapping constipation or anxiety. Probiotics can be part of the plan, but they should not delay evaluation when symptoms are persistent, severe, or changing. Here is a practical approach. Start with safety, screen for red flags. Next, identify the symptom pattern: burning, fullness, early satiety, nausea, bloating, or pain. Then review medications and meal habits. If appropriate, discuss H. pylori testing with your clinician. If no alarm signs are present and your clinician agrees, try one well-labeled probiotic for 4 to 8 weeks while tracking symptoms. Continue only if there is a clear benefit. If there is no meaningful improvement, stop. Do not collect supplements endlessly. The best sign that a probiotic is helping is not perfection. It is a measurable change. Fewer bad days, less post-meal pressure, less bloating, better tolerance of normal meals, or less nausea. But if you still have strong symptoms, do not force the story. Step back and evaluate again. So the deeper idea is this: dyspepsia is not always just acid. It can involve stomach, relaxation, nerve sensitivity, immune signaling, the duodenal lining, H, pylori, medications, food triggers, stress physiology, and the microbiome. Probiotics may help by nudging the gut ecosystem, supporting the barrier, influencing inflammation, improving treatment tolerance in some H. pylori regimens, and changing gut signaling. But they are a tool, not a cure, and not every person will respond. Look at your body with structure. Do this patiently. Measure, try, reassess, and involve a healthcare professional when symptoms persist or warning signs appear. Take care of your digestion, but do not ignore your signals. I'm glad you joined me today, and I'll see you in the next topic.